Denver, Colorado, Queen City of the Plains. Located at the edge of the high plains and at the base of the snow-capped Rockies 1 mile above sea level, it was extolled in travel literature as picturesque and healthful. An enthusiastic Chamber of Commerce touted its central location as a natural for trade and manufacturing. By the late 1890s, the population of Denver approached 150,000 people. In 1897, Denver stood at a crossroad, part urban, part rural, half agricultural, half industrial, part mountain, part prairie, and still in the process of evolving. In 1897, the profession of dentistry was also at a crossroad. Earlier in the century, the discovery of nitrous oxide by a dentist named Horace Wells had revolutionized dental practice. In the 1880s, cocaine was still the common local anesthetic. Procaine hydrochloride, later to be known by its common trade name Novocaine, was still years away. X-rays were as yet just an experiment. The benefits of asepsis were being acknowledged, though to the old school of dentists, germs were just interesting little creatures, and a dark frock coat was still a prudent measure for disguising bloodstains. In 1897, it was politics as usual in Denver. The Colorado State Capitol, with its gleaming gold leaf dome made from ore mined in the Rockies, was still under construction. Meanwhile, the legislature met in local taverns. Their proceedings opened with a bartender inquiring, "What'll you have, boys?" That year, dentists were buying quite a few of those drinks. That was the year two rival dental societies joined forces to promote legislation that would add another dentist to the State Board of Dental Examiners. On September 20th, 1897, the two groups gathered at the Brown Palace Hotel to terminate their respective organizations and consolidate their resources. Thus, the Denver Dental Association was born. The first president of the Denver Dental Association was Dr. William Smedley. He had also served as the first president of the Colorado State Dental Association. Now he turned his attention to the local dental community.
Dr. William Smedley, our grandfather, came to live in Denver in 1870. 2 years later, in 1872, he went back to Chester County, Pennsylvania, where he came from, and got his bride and brought her, and they lived in the Denver area until he died in 1926. While he was here, a bachelor, in 1870, I have a diary, the family does, of an excursion he did. I think it started October 7, 1870. Obviously a bachelor in the town, and maybe the dental practice hadn't picked up so much by then. He starts out, the mountains had been cloudy for the last 4 days, and the weather clearing and the beautiful blue sky. I decided to take an excursion to Golden City, 14 miles to the west. There exists still the diary that he wrote of a trip across the plains starting in Independence, Missouri, and going all the way to Oregon on the Oregon Trail in 1862. And he was a young teacher at that time, and why he went, we're not sure. He was curious to see the West. And it's a well-written diary and has been used as reference by several historians. And a publisher in Boulder 2 years ago thought well enough of it to republish it, so it's available in a new edition, book called Across Crossing the Plains by William Smedley. My grandfather started practicing in Denver in 1870, and soon after that built a home which still is in existence, curiously, on the Auraria campus in Auraria. But he started a practice. He had at least one associate, a man named Dr. Beals. And one office that we know of, we have a photo of it, was on the second floor of the First National Bank building on the corner of Larimer and 16th, because his name is in the window of the upstairs office. He practiced from 1870, and the first of his sons to take up dentistry, Will Smedley, started in 1898. But during that time, grandfather built a practice and a following, and was always quite studious to keep up with modern advancements, and was civic-minded and was active in the school board, in fact, president of the school board in his community for 17 years.
Just very happy memories of him coming to the office every day, got on a streetcar from 23rd and Ash and went to his office every day up in the top floor of the Republic building.
One recollection I have, not of my grandfather, but of a patient who went to him when she was a little girl, long before the days of any anesthetics. She said he was so kind and gentle and empathetic that he would say ouch for you while he was drilling on a tooth. He'd say ouch, 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 oh dear, 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 and help you through the procedure in that way, which she remembered quite fondly and related to me. He had 5 children, 3 sons and 2 daughters. They all lived well into their 80s, some 90s, and one 101. He undoubtedly was involved in the education of his children and grandchildren because he himself had been a teacher.
He loved to visit the children, and could have been after the Smedley School was built and named after him. But because he visited these schools and other schools and call on each child individually, you know, shaking hands with them or touching and saying words. So he was very interested in the children, not only his own grandchildren, but small children.
Smedley's pioneering spirit continued to lead him in later life. He was also a dental pioneer and co-founder of the first dental group in the United States, the Smedley Group of Denver, modeled after the Mayo Clinic.
The Smedley Dental Group was founded in 1919, and my father and 2 uncles, one was Dr. Max Giesecke, who married my aunt, my father's sister. So there were grandfather Smedley and really 3 sons, and they decided that it would be wonderful to form a group practice somewhat modeled after the Mayo Clinic. So they went and visited the Mayo Clinic and invited Dr. George Warner, Dr. Clay Withers, Dr. Ernest Netherton to join them in forming the Smedley Dental Group. They then decided that they'd have to divide up into specialties to offer this service to patients, and it was almost a toss of the coin as to who would be a prosthodontist, who would be a periodontist, who would be an oral diagnostician, and who would do general restorative dentistry. And my father happened to be assigned or volunteered to be a prosthodontist, which he did for the rest of his life, and later became a founding member of the Academy of Denture Prosthetics. Dr. Max Giesecke took on the periodontal department and ran that for his entire career. Prior to that, they had all done just general dentistry. But it seemed to be very successful, and for many years they were rather prominent, and we think that they are the first such group of dentists to form a group practice.
One of the first orders of business for the new Dental Society was to help organize the annual meeting of the National Dental Association, scheduled for the summer of 1910. The successful presentation of the theme Oral Hygiene helped awaken local dentists to their responsibility for educating the public. A Colorado Springs dentist, Dr. Frederick McKay, was in the middle of an extensive study of brown stain, a phenomenon peculiar to the citizens of his city. Later, this was found to be caused by unusually high natural levels of fluoride in the public water supply. It provided the topic for the Denver Dental Association's first public oral hygiene lecture. In 1911, it also inspired the Denver Dental Association to appoint a committee to inspect the teeth of Denver school children. The committee discovered that truancy was a serious problem in Denver, especially among the offspring of miners and other children of the working poor. The chief cause was, amazingly, toothache, which the committee soon learned was due to massive decay, the result of flagrant oral neglect. In the autumn of 1911, the DDA committee met with the Denver School Board to discuss creating a free dental clinic for indigent children. DDA offered to provide the necessary dentists without charge if the school board furnished the room and materials and paid for a full-time dental assistant. All DDA members were encouraged to contribute $1 and 1/2 day's work each month to the school clinic, then quartered in a neighborhood house at West 10th Street and Galapago Avenue. Over the years, the DDA continued to support the children's clinic, even after it was abandoned by the school system during the 1920s. The clinic evolved through several identities. It was first known as the Denver Public School Clinic, then the Metropolitan Child Dental Care Association, and finally, Kids in Need of Dentistry, better known by its acronym, KIND. Today, KIND has expanded to 5 clinics whose dentist volunteers provide low-cost dental treatment to children of disadvantaged families throughout the Denver area. 85 years later, the founding of KIND is still considered one of the local dental community's finest achievements. The new century brought a wave of specialization. Dr. Arthur Ketchum, an orthodontist, was the first dentist to hang out his shingle in Denver as a specialist. He was followed by a periodontist in 1908 and by an oral surgeon in 1909. In 1910, Dr. Clyde Smedley, the son of William Smedley, limited his practice to prosthodontics.
In those days, you didn't have to do anything but declare yourself a specialist, which he did, but presumably you would pursue your continuing education and further your skills in the field, which he certainly did, and he attended all the meetings he could possibly attend and became known quite well across the country. He wrote and had published a number of articles, and therefore was invited to be a founding member of the American Academy of Denture Prosthetics, they called it then.
It was not until 1917 that the 5th dental specialty was introduced. That year, Dr. Paul Barker devoted his full-time practice to the field known as children's dentistry.
After Dr. Paul Barker set up his practice for dentistry for children, the first group of dental hygienists graduated from the Colorado College of Dental Surgery. Following that, in 1930, Dr. Benjamin Kletsky came back after training in children's dentistry at Forsyth Clinic in Boston, and he set up his practice in children's dentistry. Incidentally, Dr. Kletsky was a vice president of the American Dental Association, and I am positive that had he lived, had he not succumbed to cancer, he would have been a president of the American Dental Association. In 1940, Dr. Robert Downs came back from the University of Michigan, where he had received a master's degree in public health dentistry, and he became the very first public health dentist in the state of Colorado. Among Dr. Downs' many accomplishments, he had arranged that the two pedodontists, Dr. Barker and Dr. Kletsky, would go throughout the state and teach other dentists how to treat children properly so that the children could receive a proper service. Following World War II, Dr. William P. Humphrey did his work on the steel crowns, and that revolutionized children's dentistry by being able to save primary teeth which previously had been extracted. The very first master's degree in pedodontics was accomplished by Dr. William E. St. John in 1948. In 1950, Dr. Robert Freeman received the very first master's degree in orthodontics. And Dr. Freeman's work in orthodontic diagnosis by means of cephalometrics is what helped to revolutionize orthodontics so far as the diagnostic procedures were concerned. Previous to that period, many of the children were hospitalized and received a general anesthetic in order to have their teeth extracted. It was in 1951 when the very first program for full mouth rehabilitation for children under a general anesthetic was performed. The program was set up at St. Anthony Hospital. And at the time that I set up that program at St. Anthony Hospital in 1951, the anesthesiologists would only use ether as their general anesthetic. Of course, with ether being so highly explosive, we were not permitted to use any electric motors, and that's why we had to perform our dentistry by using the old foot-powered, as they called it, field dental drill, the foot-powered dental engine. And it wasn't until 1956 that the anesthesiologists elected to use a different form of general anesthetic so that we could use electric motors, and this was a great improvement. In 1964, Dr. James Pierce became the very first Colorado dentist to limit his practice to endodontics. And also, incidentally, as with Dr. Kletsky, Dr. Pierce was the very first Colorado dentist to be a trustee to the American Dental Association, representing the 6 states in the 14th district. Dr. Robert Schallhorn, of course, is recognized as a national and international leader in periodontics, as was Dr. William Hyatt.
During the 1920s, Denver dentists faced a new challenge. A couple of decades earlier, Dr. Edgar Randolph Parker had his name legally changed to Painless after running afoul of a New York law forbidding the use of an assumed name for professional purposes. It was as Painless Parker that he set up an office in Denver at 1206 15th Street in 1923. Recruiting patients was easy for Painless Parker. The entrance to his office was flanked by pulpits from which barkers harangued passers-by. Parker himself traveled throughout downtown Denver in a wagon, challenging local citizens to sample his painless method of dentistry. So-called volunteers, usually well-rehearsed, would allow Parker to demonstrate his skill before the crowds. After a good deal of theatrical pulling and tugging, Parker would triumphantly hold up a tooth which he had palmed ahead of time. Impressed by the presumed patient's vitality, Denver citizens would surge toward the wagon, eager to sign up for an appointment. But Parker couldn't handle the volume he attracted, and few dentists were willing to work for him. Reduced to hiring drunks, derelicts, and drug addicts, he turned in desperation to the political process. An amendment Parker proposed to the dental practice law would have allowed reciprocal licensing without examination to dentists from other states. For good measure, he included a clause that would also allow him to advertise as flamboyantly as he pleased.
In learning about the history of dentistry in Colorado and Denver, naturally we heard about the story of Painless Parker with all of his flamboyancy and all that he had accomplished and the size of signs. But I recall very vividly in 1951 is when I came here, if you had a sign, any lettering that was any larger than 2 inches, you certainly heard from the committee and heard about it very, very quickly. All of us were disciplined. We were regimented into the routine of being as highly ethical as we can. No one to have any advantage over anyone else with regard to signage or even with regard to what was included in the yellow pages of the telephone directory.
Parker's campaign to pass Amendment 6 was designed to convince people they were being victimized into paying exorbitant fees for dental services. He blamed this on a, quote, dental trust, a thinly veiled reference to his colleagues in the Denver dental community. This trust, he claimed, had conspired to keep out competition and lower fees of honest dentists such as Painless Parker.
The dental trust says you are so simple-minded that you cannot determine right from wrong or what is good or bad for your own welfare. This trust is a gigantic fraud. It is built upon mystery stuff, star chamber statistics, and backstairs diplomacy. It is afraid to come out in the open and discuss dentistry, afraid that if it does, you may find out too much about what goes on behind the curtains. This dental trust is a big, overfed, puffed-up giant like Goliath of Bible fame. Just as merciless and just as arrogant as Goliath ever was. The public needs a David to put this trust down and out. Painless Parker, with the aid of your vote, is the man who will do the job. Go to the polls and put good dentistry within the reach of all. Put Goliath and his gang where they belong. Painless Parker, honest dentistry.
Local dentists banded together to condemn the Parker Amendment. The Denver Dental Association joined the Colorado State Dental Association in assessing each member an additional $25 in dues, a considerable sum in those days, to pay for the battle ahead. Every ad Parker placed was countered by an ad from Organized Dentistry. Member and non-member dentists alike deluged the editors of local newspapers with letters. In the end, the effort paid off. When votes were counted on November 6, 1926, it was clear that Amendment 6 had gone down to a resounding defeat. Soon, allegations of neglect and incompetence against the Parker clinics caused the State Board of Dental Examiners to intervene. By mid-1929, Painless Parker and the ragtag collection of dentists who worked for him were without licenses to practice in Colorado.
We find over time contradictions. We find what was once considered bad or evil or unacceptable has, because of environmental changes, attitude changes, societal changes, we find that that is reversed. Licensure by credential is a good example. Although I'm not knowledgeable about what that term specifically meant at the time of Painless Parker, it certainly had, I'm sure, the effect of making it easier to become a practicing dentist in Colorado. I doubt very much that it was as specifically defined as it was in the effort last year, the successful effort, to get licensure by credential passed in the Colorado State Legislature. But in any case, we could never deny that it represents a considerable change in attitude.
As the 1930s began, while the nation struggled with its moral and economic conscience, Denver dentists faced an educational crisis. 20 years earlier, there had been 2 dental schools in Denver: the Denver Dental School, loosely associated with the University of Denver, and the Colorado College of Dental Surgery, originally under the administration of the University of Colorado. After a decade of intense competition, culminating in the theft of a large plaster tooth, which caused a near riot among students, the 2 colleges combined. This joint venture became known as the Colorado College of Dental Surgery, under the administration of the University of Denver. The Dents, as the DU students called themselves, soon had their 3-year course of study expanded to 4 years, and tuition was raised from $75 to a whopping $100 a year. The student population nearly quadrupled during those years, and the school appeared to be thriving. But a basic weakness that was eroding the foundation of dentistry in the United States would also undermine dental education in Denver as well. Dentists had traditionally seen themselves as mechanics and technicians. Now, they came under attack by the medical community for a lack of respect for scientific research and humanitarian concerns. Physicians and surgeons contended that medical supervision of dental education was needed to stop the spread of techniques that had become a concern to the public. Increasing public demands, together with the onset of the Great Depression, forced the dental school to close its doors. The last dental student graduated from the University of Denver in 1932. Thus began a dark age in Denver's formal dental education that lasted for more than 40 years.
The first office that I had in Denver happened to have been the offices of many of the men who had been in the dental school. Incidentally, there were also 4 lady dentists who were also part of the dents. During the period of their being in dental school, they had told me that most of them worked for the old Denver Railway Company. They were conductors and motormen on the Denver streetcar line, because even in 1951, when I came back, the streetcars were still rolling all around the city of Denver. They were a great group of men.
Local study clubs managed to fill in some of the gaps in dental education. In 1934, through the efforts of Dr. Louis Edelman, Dr. Henry Hoffman, and Dr. Glenn Cody, co-founder of the Cody Dental Group, the Denver Dental Study Club experienced a resurgence. In 1951, the study club moved from its traditional home in the Majestic Building to the basement of Denver General Hospital. Calling upon local talent to provide educational programs, the club met regularly from September through May. More than 1/3 of all Denver Dental Association members participated in study club activities. The club even received national notice with an article in the ADA News, and over the years presented many subjects well ahead of their time, including Miles Markley on dental amalgam, William Hyatt on periodontics, Glenn Cody and Dennis Nelson on case management, and many other distinguished speakers during the club's heyday.
The Denver Dental Society Study Club was first talked about and organized in 1934. It was chartered in 1936. The study club held its first meetings in the old Kittredge building, and I'm not sure exactly when they had to move, but they moved to the Majestic building, and they stayed there until just before the war. They moved to Denver General Hospital basement after the war, because that's when it became a useful place for the state board and for study club classes. And the main reason for the study club was to have working classes, and by having the units there, we could have working classes at Denver General.
About the Denver Dental Study Club, I have been involved in it for a long time. Of course, my father and uncles and family and the members of the Smedley group all encouraged me in that direction. My principal mentor was Dr. Miles Markley, who was the director of the Mile High Study Club. He was a marvelous teacher, quite an engineer in his approach to dentistry. He was meticulous and demanding and inspiring. And he even had the entire study club sign up for 1 year with the Toastmasters Club that he happened to belong to, so we would learn to be public speakers. He insisted we all purchase cameras and learn to do intraoral photography and learn to present papers. And he also gave us the background of information to know what to present a paper about. This was through the study of silver amalgam technique, gold inlay technique, crown and bridge, and so those were the topics that I gave a few talks on.
Study club dues in the early days were $15 per year for each member of the Denver Dental Society. And the reason for this was to take care of all of our nominal expenses we had, such as putting out a booklet and our postage and anything else that might come up. As far as the increasing of the dental dues, that was done at my request when I became chairman about 1960, and we may, I don't know when we accomplished it, maybe 61, to start charging more for the classes so that it would be an ongoing thing, and it paid for itself and was profitable. And being profitable, then we were able to build a fund that we could
fall back onto in later years because we thought we would ultimately lose our home at Denver General Hospital and have to equip and find a new place in the future. The study club, from the time I started building a nest egg, so to speak, for the study club to move ahead, we built up a pretty good fund, and I don't recall the amount, but it was certainly in excess of probably $11,000 or $12,000. And at that particular time, the Metropolitan Denver Dental Society was having its trouble financially, so they would borrow from the study club. As far as the success of the study club is concerned, it was well known, well, actually all over the United States, and it was well known certainly in Denver and the Rocky Mountain region, because we had one of the first really going study clubs in the area, and we had people inquiring from all over about the classes, and we had some excellent instructors. Some of our own dentists in the region were top-notch individuals and really put their heart and soul into the study club and the classes. I was involved in study club activities both as a moderator and an instructor. I taught a class for a number of years, and I found this to be very rewarding. It was helpful to me. It was also helpful, I thought, to the individuals who participated in the classes. And when you get a group of individuals together, you can't help but learn from each other.
Ironically, the same motive that drove the study club to excellence also contributed to its demise. In their quest for the best in dental education, Denver dentists expended much time and money in attempting to start a new dental school. By 1973, a freshman class of dental students had enrolled at the new School of Dentistry at the University of Colorado Health Sciences Center. Less than 10 years later, having performed a vital service to the profession, the Denver Dental Study Club bowed to the competition and faded from the scene.
Opening of the dental school, I think, ultimately did contribute to the demise of the study club, because at that time, all dental schools throughout the United States were becoming more interested in continuing education classes, and members were more interested in taking trips to take these courses. Ultimately, it cost them a lot more money, but they got some vacation and enjoyment out of it at the same time. And it wasn't nearly as interesting as having something at home that was very simple and close by.
There was controversy about whether or not there should be a dental school. But all of these things were overcome. And ultimately, the legislation was passed, and ultimately the profession, including the Metropolitan Denver Dental Society and the Colorado Dental Association, were able, through their efforts, to help raise the private money that was needed to supplement the state money in order to begin the dental school.
World War II brought other changes. The advent of antibiotics and the emerging role of women in the professional world as men served in the armed forces created new challenges. In Denver, one of the most important changes to the dental profession occurred on September 11, 1944, when Miss Grace Ogle was hired by the Denver Dental Association, the Colorado State Dental Association, and the State Board of Dental Examiners to act as their joint executive secretary.
Can't say enough about Grace Ogle. She was a great lady. She signed me up to take the Colorado State Board, and I've known her ever since. And without her, I don't think we could function.
I think from the day she was hired entailed at least 3 primary categories of responsibility. One was the Colorado Dental Association. The next was the Metropolitan Denver Dental Society, and also the State Board of Dental Examiners. And I think from the beginning, and I'm not really quite sure how long, she was the only staff person for all of those activities.
Grace Ogle was the first person I think I knew at the Dental Society, and I thought that she was in charge of the Dental Society, and I think she was in many ways. She ran a tight ship, and she was very firm with us. There were some dentists who were trying to get out of paying all the dues for the meetings because we were not making much money at that time, and they were very expensive for us. And she was still very firm and said, "You can handle this, and you know, we'll give you a little time." And she was a good mothering, firm kind of a personality for us young dentists who were coming in at that time.
Miss Ogle has always been a marvelous person to turn to. During all of the years of my activities in the society, I knew that Miss Ogle would guide me sternly. She had no hesitancy to discipline when necessary. She was a great lady.
First and foremost, Grace was a very, very dedicated person. She had a cat and a car and her job. And her job was very, very important to her. She was concerned about the detail and everything she was involved in. She was an extremely meticulous, careful person, and she wanted everything to be done as right as it possibly could be done. And I remember reading a reference in the book about Colorado dentistry. It was by the author of that book who said, you know, as I was researching the history of the Metropolitan Denver Dental Society and the Colorado Dental Association, I noticed how much easier things got in terms of finding out about what was going on and learning about the details from the way the records changed immediately after Miss Ogle took over in 1944. And I think that's very accurate. She was, above all else, extremely meticulous, and I think very, very respected by the dentists in the community.
One of the most significant changes in dentistry following World War II was the advent of dental insurance. Regular dental care, once limited to people with plentiful incomes, now came within the reach of factory workers and other working-class citizens. In the late 1950s, local dentists obtained a grant from the Colorado Dental Association to pioneer a company they called the Colorado Dental Service. It was the seeds of a company that would eventually become the Delta Dental Plan of Colorado. Designed to provide affordable dental care for the local marketplace, the plan was also administered by the providers of dental care, the dentists of Colorado.
Well, dental insurance really began in the mid-50s, and it began on the west coast of the United States with two unions. It was a longshoremen's and a warehousemen's union that negotiated for and got a dental benefit in their new contract. And at that time, they made an offer to the dental profession in the states of California, Oregon, and Washington. And it was one of those offers that it was very difficult, I think, for the profession to refuse. It had a good and a bad side to it, and it was recognized as such, but ultimately it was recognized again as something that couldn't be refused. So in each of those states, the dental profession got together and formed a committee to work with that request, and those were the seeds that began what today is known as the Delta Dental Plans. That movement over the subsequent years began to creep eastward, and it came to Colorado in one sense in 1958, at which time a very small grant of around $500 was given by the Colorado Dental Association to a committee that was intended to begin something along the lines of a Colorado Dental Service Plan.
The 1960s were truly the best and worst of times. The Vietnam War brought problems to Denver, but also prosperity in the form of defense spending. Champus benefits enabled the Denver dental community to expand and grow in a way it had never grown before. It was around the same time that the DDA, now called the Metropolitan Denver Dental Society, hired its first executive director. a young man fresh from the American Dental Association named Tom Oberle.
Grace Ogle's reaction was certainly very suspicious and skeptical about this obviously young punk kid. What could he know? And she had been in the position, obviously, for 25 years at that time and had every right to feel that way and every right to believe that there isn't much somebody that experienced could bring to the table. And I think she was probably right.
When Tom Oberle first came to MDDS, I believe that he was about 20 years younger than me at the time, but even then, I thought that this is a young man. And it didn't take too long to realize what his capabilities were. In fact, it got to the point where, as I advanced in the hierarchy of the association, I would have been lost as an officer had it not been for Tom. Tom is brilliant in the way he was able to handle all of us, help the organizations, and we have progressed beautifully.
There was a recognition that there were changes taking place, and the changes had a lot to do with what was happening within the profession. It was becoming more and more of a profession, more and more a part of the healthcare delivery system. Dental insurance had entered the picture, and that was becoming a challenge for the profession and was changing the economic elements of how a dental practice operated. And then there was the boom taking place in Denver and the influx of people as well as dentists. And there was also the growing interest in developing a dental school. All of these things, I think, added up to a general recognition that change was taking place, and that change had somehow to be addressed by the profession.
He had a calming effect on meetings with people. He had difficult meetings with people over issues that were uncomfortable for all involved, and I remember how well he handled those situations, making everybody comfortable and yet getting to the core of the issue. He's a very talented and special man.
Well, I can't say enough about Tom Oberle because I've known him ever since he came on board, and I think without Tom's help, all of my years and what I did in dentistry and for the MDDS would not have been as successful or as easy without Tom Oberle. He was a top-notch individual to organize things and look ahead, and well, he just made the job easier. He took a lot of the work off my shoulders.
After having been here for 10 years, I, at that point, had a wife and 2 young kids. And the job wasn't much different in those days than it is today. It required then, as it does now, a couple of nights a week and maybe 1 or 2 weekends a month, or a portion of those weekends. And I decided that I needed to spend more time with my kids, and frankly, probably needed a change. So I made the decision to move on. And I stayed in the healthcare business in a variety of different ways over the next 13 years. And then was, due to, I suppose, a variety of circumstances here at the Colorado Dental Association, was given the opportunity to return. And I'll admit, I sat back and thought about it for actually quite some time before indicating that I would be willing to go through at least the interview process and consider returning. I ultimately did decide to return, and I suspect the only reason I was allowed to return is that all of the people who were interviewing me had forgotten all of the mistakes and foolish things and trouble, I suppose, that I had caused during my first 10 years here.
The 70s and 80s brought many technological innovations to dentistry. Nowhere was this reflected more than in the changes to the Denver Midwinter Convention. From its inception in 1907, the Midwinter had traditionally been an informal meeting emphasizing continuing education for local dentists and attracting a few exhibitors to help pay the bills. But in the late 70s, it began to expand, even as the city of Denver expanded during the years when oil barons built massive skyscrapers throughout the downtown area. Tradition gave way to progress until the Midwinter outgrew its headquarters at the Denver Hilton Hotel and relocated to Corrigan Hall. Not long afterward, it moved across the street to its present location at the Colorado Convention Center in downtown Denver.
In 1969, when I came to Denver for the first time, Dr. Bob Janetsky corralled me to become his assistant, working with the exhibits at the Denver Midwinter at that time. And so I was his assistant for 1 year, not realizing that he had motives to have me become the chairman, and he was going to retire from that job.
I arrived back in Colorado to set up my practice in 1951. That was in September, and the first Midwinter was just a few months afterwards, and it was then held at the old Shirley Savoy Hotel. Everyone was wonderful. There was such great camaraderie. There were special little programs. There was a lot of private room gambling that was being protected by the police, the poker games and dice games. The smoker that was held just for the male dentists had the young ladies come out and do their thing, which was in no way comparable to what we see today just walking down 16th Street or out at the Cherry Creek Mall. The meetings primarily were the meetings for the scientific sessions. It was a wonderful feeling. More often than not, we had black tie dinners. And I recall vividly one year when Dr. McCarthy charged me with the responsibility of the programming, the entertainment for one of the black tie dinners, and it was thought we would have the original ink spots. I recall that very vividly. We had a great time. The feeling of camaraderie, the feeling of cooperation was so existent then. Everybody's helping each other. It was the most wonderful time to come and start practicing dentistry as a young man.
It was a lot more of a social situation when we had the conventions back in '69 and later. It was held at the Hilton Hotel, and everything was housed in one building, which is a nice feature for a convention. People could spend the night there. We had our meetings there, our lectures, and we had the exhibits there also, as well as the social events. So everything was in the Hilton Hotel. That created a nice atmosphere for people to enjoy each other for the few days of the convention. At that time we had well under 100 participants or booths in the convention, and everything was fitting into the ballroom of the Hilton Hotel. Some of the exhibitors who have been with us since I can remember have been companies like S.S. White, Patterson Dental Supply, Rocky Mountain Orthodontics. A lot of the local laboratories have been with us for a long time also. The biggest role I feel that I've played over the years in helping the meeting grow is to create an atmosphere of being pro-exhibitor and trying to make sure that if they have a problem that we deal with it. And we solicited their ideas year after year in an informal and formal way to come up with ideas on improving the meeting. And many of those ideas we have instituted, which have helped the meeting grow as it has. To me, I think my second dental school was Dr. Miles Markley. He taught me so much after I graduated from dental school and gave me a lot of assurance in the way I was treating patients. He is, I think, the John Elway of dentistry, not only in Colorado but nationally. He's done so many things to influence so many wonderful dentists to excel. A lot of the clinicians at the Midwinter have been local dentists. As mentioned, Dr. Miles Markley was a prominent one. We've had the Smedley group contributing a great deal to our education. Dr. Schallhorn, Dr. Wilbur Eames, a number of others in the area have been very generous with their time and talents in helping the rest of us grow in dentistry.
I think the Midwinter meeting grew. One of the reasons certainly was the Denver location. And there, as today, there aren't many competing urban centers for this Rocky Mountain region of the United States. And so there were those that wanted to come out and visit the mountains or wanted to go skiing, wanted to visit this state, and I think to some extent that attracted a certain percentage of the attendees. And then there was a movement during that same period of time to begin including programs that would present scientific programs or practice management programs that were of interest to the auxiliary personnel. to the front desk people, to the dental assistants, to the dental hygienists, even to the dental laboratory profession. And there was also a major push to enlarge the number of exhibitors. First of all, it was recognized by the exhibitors that this was a wonderful opportunity to reach the dentists in this part of the United States. And secondly, I think there was a great deal of cooperation, you might say, a great deal of interest on the part of the profession to attend that meeting.
Each year we tried to make the convention grow, trying to attract more exhibitors. At one point we got to the place where we had to divide the exhibit hall, or the exhibitors, put some of them on other levels of the Hilton Hotel besides the ballroom. And that was a sign that we needed to consider moving the midwinter meeting. And so that was the trigger to have us move to Corrigan Hall. And that was a scary move at that time because it was very much bigger than we needed. And so it was a move of faith, I think, in heading in that direction. The midwinter grew for a number of reasons. I think one of the big reasons is the popularity of Denver, being near the mountains. Dentistry had a wonderful reputation in Denver across the country. We had people like Dr. Miles Markley who were spreading the reputation of quality dentistry in Denver. We were attracting better speakers year after year. More dentists were attracted to the mountains in the Denver area and came out here for selfish reasons, as I did, because I wanted to live near the mountains. The midwinter is going to continue to grow. A great part of it because there is a focus on the planning committee to make it grow. And the leadership that we've had now and the previous administration are very talented also in trying to make this meeting develop into one of the top 10 in the country. And we're close to that point now.
Just since I have been a dentist, which in 2 years will be 50 years, I can remember a tremendous number of improvements. Probably the biggest is the high-speed turbine and the reclining chairs for better comfort of patient and dentist with volume suction equipment. But there's been a vast expansion and improvement in dental materials. Bonding is now routine for most restorations, and it's possible for us to do better and better. But even so, I think the demands of meticulous technique and, in my opinion, study club work are still just as important as ever.
The staff at the MDDS right now is the key to the success of this meeting. They talk about all that we do as committee chairman, but I know that a lot is being done while I'm working on patients during the day. A lot is being done here during the day, week after week, throughout the whole year. And if we had to do what is accomplished here at MDDS office, it couldn't get done. We wouldn't have a meeting. So the staff that we have now, and Claudia as its head, with her inspired ideas and managerial skills, is very productive at this time. We really appreciate her.
When I was told I was going to be interviewed about some of these historical topics, I went out and took a look at the pictures of all of the presidents of the Colorado Dental Association and tried to recall all of the presidents of the Metropolitan Denver Dental Society that I had dealt with over my years with the organization. And I couldn't help observing that, without exception, these were all people that were primarily concerned about the profession, about the quality of the profession, about the quality of the organization, about fulfilling the mission of organized dentistry in meeting the needs of the profession and meeting the needs of the public. And that is true to a man.
So many individuals have contributed to the history of dentistry in Denver. It would be impossible to mention them all, but all are remembered, and the memory of each is esteemed. It has been said that those who cannot remember the past are condemned to repeat it. It's just as important to remember that the past is also our bridge to the future. and the future holds such promise both for our city and for our profession. From foot-powered dental engines to high-speed handpieces, from laughing gas to virtual reality, dentistry has progressed by giant leaps over the past century, and Denver has progressed right along with it. Sometimes our initiative has taken us many miles down a wrong road, but more often it has helped us climb the mountains of our potential. Like the early pioneers who gazed upon a barren plain and imagined the great city that was to become Denver, the Metropolitan Denver Dental Society looks toward tomorrow and sees the possibilities. Today, the 1,300 plus members of MDDS collectively maintain our mission of supporting the highest ethical practice of dentistry and enhancing the standard of care for the publics we serve. Along with the Colorado Dental Association and the American Dental Association, we stand together as a unified voice for our profession. Although we take pride in the past, we fully embrace the present and join our colleagues throughout the state and nation in affirming the conviction that our best days are yet to come.